Welcome back to Optimize Health, where we're making easy, healthy, and delicious meals. Today we are doing an information video on a sort of newer topic that we've been hearing circulate, and we just wanted to address some basic points that we can try to help our viewers with. We're talking about exercise snacks. If you haven't heard, these are short little bursts of exercise or a workout, typically about 1 minute or less. Maybe, that can be flexible depending on your fitness level and what the particular activity is that you're doing. And we wanted to bring this up because it's quite interesting. We do a lot of food and a lot of diet and wellness related videos, and we haven't really addressed exercise and how it comes into play. And apparently research is showing more and more that metabolic health is not just about what we eat, but also about the lack of activity, that's so prevalent in Western civilization. So having healthy food is important, but also having a healthy movement regimen is also very important to our metabolic health. So we'll go into some of those factors and just some of the facts about that in just a bit. What I did want to also mention is how everything kind of tie together with exercise, and how exercise can help with circadian rhythm of our body as well as fasting. And it can also be a very effective method to reduce cortisol, which reduces stress, and that allows for, if you've seen our hormone cascade video, and it's particularly with women's health very important that we lower cortisol for the benefit of our reproductive hormones, which affect our whole body and mood, as well as for belly fat in particular, since cortisol is a huge driver of storage of fat in the abdominal region. And so moving from there, I just wanted to explain some really interesting benefits of exercise snacks, including production of beta hydroxybutyrate, which we know is a fatty acid that is protective and helpful to our gut lining, as well as a signaling molecule that is often encountered when we're fasting or we're doing a fatty, very low carb diet, and all those benefits that are induced in the epigenetic realm of our cells at different levels and different tissues. And exercise snacks also can help to reduce our blood sugar and therefore stabilize our insulin. You should talk to your doctor, healthcare provider, or veterinarian to see if any of these recipes, suggestions, or contents of these videos are right for you. Nothing contained in these videos are intended to be taken as medical advice. Use at your own risk. Insulin, which is really helpful for maintaining and for losing body fat, as well as some of these other insulin-driven diseases, which we're learning more and more. A lot of Western civilization, a lot of the ailments that affect many people in the West due to lack of movement, due to eating all day long and eating carbohydrates and sugars all day long, is due to the effects of insulin. So these exercise snacks are these brief, 30-second, 1 minute intervals of physical activity that can be sprinkled throughout the day, maybe something like a few times in the morning, a few times in the afternoon, and the evening. There may be 5 to 10 times that you could get a minute of activity in and really see benefits. So the other things we can talk about is that specifically, it's interesting that exercise snacks could help to negate a break in our fasting window. If we're supposed to be fasting and we have a very small snack, maybe not the highest carbohydrate snack, and we're concerned, we don't really want that to have a negative effect, and a quick little exercise snack could help to reverse some of those potential negative impacts and make it like you've never had the snack at all. And we know that this benefit that we're seeing with exercise snacks, with insulin and reducing glucose, this is because skeletal muscle is responsible for about 80% of our post-meal glycemic index reduction and the glucose level in the blood. 80%. And particularly, you can maximize the benefits of exercise snacks when you address the large muscle groups, the legs in particular, doing compound or complex movements where you're doing like a chest press or overhead press, where you're doing rows or something with engaging many muscles in the back, and obviously things like squats or lunges, things with the legs, which are the larger muscle groups, will help to maximize the benefits of this. And some other things that are maybe not so obvious, but if you just don't have time to commute to the gym, to change into and out of and shower, changing in and out of clothes, showering after a workout, with an exercise snack and doing multiple throughout the day, you're not going to sweat as much. You won't have to change your clothes for a lot of different exercises, and you're still going to get a lot of benefits as it adds up, accumulatively. So I do, utilize this technique, and I find that it's helpful for me. Some of the main things to consider are large muscle group activation, as we mentioned, things like doing cardio versus resistance training. Depending on what you're trying to do, there's benefits to both, and it's probably best to have some balance between the two. And then also flexibility, depending on what your potential range of motion limitations are or what you want to maintain. You may want to do some stretching, and it could be a good thing in the evening for winding down, is just doing some flexibility exercise snacks. Going more into some of the nitty-gritty, I wanted to read an excerpt from an interesting article that I got from the NIH website. I think it came out in about 2020, so not too long ago. So let me start here. Physical activity represents a potent non-pharmacological intervention, delaying the onset of over 40 different chronic metabolic and cardiovascular diseases, including our common ones that we all know: type 2 diabetes, heart disease, and also reducing all-cause mortality. As we mentioned, acute exercise improves glucose homeostasis with regular participation in physical activity, promoting long-term improvements in insulin sensitivity, spanning both healthy and quote-unquote healthy or non-healthy or diseased population groups. At the skeletal muscle level, exercise promotes significant cellular reprogramming of metabolic pathways through the activation of mechanical and metabolic sensors. And these will coordinate downstream activation of transcription factors that augment targeted gene transcription associated with mitochondrial function and the substrate metabolism of our foods and other compounds that our body uses. So I don't want to get too deep into, it's very technical and scientific, but I will include the link to the article if you're interested, and would definitely like to hear any questions or comments you have. We can discuss for further details on that. So definitely check it out, maybe try it out, and let us know what you're doing that is working for you. And please like, share, and subscribe, and we'll see you next time. Thanks.